Welcome back, everybody. This is our fourth video in our mini-series regarding progressive aging. Again, my name is Riley. I'm a doctor of physical therapy and geriatric specialist at IPAL Physical Therapy. One of the more common things with progressive aging that tends to be a hardship for people tends to be related to balance and falls. With balance and falls, we tend to see 1 in 3 people over the age of 65 have 1 fall per year, and 1 in 2 people over the age of 80 have 1 fall per year. Unfortunately, out of those falls, 20 to 30% of those falls result in moderate to severe injuries. Additionally, falls are downplayed, and we see this a lot in the clinic because people associate falls with injuries. And we see a lot of the times when people have a fall, just because they didn't have an injury, they generally don't think that they fell. And that's actually completely opposite of the truth. A fall is actually classified as a uncontrolled descent to the floor or even an extension of the floor. And what that could be is like your wall, your refrigerator, your dresser, those things. So if you do lose your balance and you hit that, that is actually classified as a fall. So today I'm going to show you 3 different screens that we can go through to test your balance and see how you do on those. But you can also use those screens as functional exercises in the home to try to improve your balance. I do ask that when we do these activities or these exercises that you have something sturdy to hold on to, just in case if you do lose your balance. So the first screen I'm going to show you is a narrow base stance, and all we're going to do is we're going to take our feet, we're going to move them as close together as we can, and we're simply going to try to hold this for about 30 seconds. If in standing in this pose, if you notice any increase of sway, or if you notice that your feet keep trying to peel off the carpet or the floor or whatever it may be, take note of that. The second screen that we're going to do is a single leg stance. That's where you're going to try to stand on one leg. This is where something safe or to hold on to is important. What we're going to do is we're going to pick up one leg and simply try to hold it for about 10 seconds. After that is completed, or if you're unable to do that, compare it to the other side and try the other leg. Again, we're trying to hold it for 10 seconds. The third screen we're going to try is a tandem stance. On this activity, what we're going to do is we're going to put one foot in front of the other, almost like if you're standing on a balance beam or a wooden plank. So what we're going to do is we're going to take one foot, put heel to toe, and try to hold this for about 10 seconds. Again, if you're unable to do that, let's compare it to the other side and let's see if that makes a difference. Now, if you did those screens and you felt good about them and you weren't really unsure or felt unsteady, you can actually utilize those as balance exercises. The suggestion would be is to try maybe 3 to 5 times a day, but go ahead and try to progress the duration of those from 10 seconds to 20 seconds, then maybe to 30 seconds and 40 seconds and so forth. However, if you felt very unsure about those or if you felt very unsteady, that is actually a sign of a balance deficit, and that may be something that we can help you with as physical therapists in order to improve balance and also decrease your fall risk. If any of you guys have any questions regarding any of those screens or those tests or anything like that, please feel free to comment below, shoot me an email, or even call our office for additional information on those balance screens or those balance exercises. We just ask that you stay safe, stay healthy, and in the pursuit of wellness.